Hi everyone, welcome to this video on OET Reading Part A. Now in this video I'm going to show you some of the traps that are set in Part A. That is, students who perform relatively well when it comes to reading, even such students fail to identify such traps. These are minor things that are easily understandable, but students tend to overlook such aspects when it comes to OET reading. Now through this video I'm going to show you some hand-picked questions from the official materials across different tests, and we'll analyze or understand what are the different kinds of such traps that can appear in OET Reading Part A. It's not because that you're not understanding the question or you're not understanding what the text is all about, but you might fail to notice certain words or judge the right meaning of the question. Okay, so let's start. Now you can see the first question on the screen. The question says, what is the maximum dose of morphine per kilo of a patient's weight that can be given using intramuscular route, IM route? Now Part A, as you know, there are 4 texts, and initially we'll be just skimming through all 4 texts to understand what is the basic or main idea that each of these texts convey. Now after that, based on the question, you start scanning. So now this question says, what is the maximum dose of morphine? So immediately our attention will come to this drug therapy protocol. Now that talks about drugs. And then the question is regarding dosage of morphine, and that can be given using intramuscular route. Now as you can see in this table, you can see an entry as morphine, and it's talking about intramuscular route. So here 2 routes are given, intramuscular and subcutaneous SC. Now we understand from the question that we have to focus on intramuscular route, which means that our focus will narrow down to this part, IM. And the question is to identify the dose. In this column you can see the recommended dose. So here for morphine intramuscular route, the recommended dosage is per kilo. The dosage is 0.1 to 0.2 mg per kilogram. Now majority of the students tend to write this 0.1 to 0.2 mg. Per kilogram, you don't have to write per kilogram because per kilogram is already given there. Now they would think that they have rightly identified. They have first chosen the right medication, morphine, then they have chosen the right route, intramuscular, and they have selected the dosage appropriately. Now is there something lacking in this answer? Of course yes. You failed to identify the keyword maximum. What is the maximum dose of morphine? They've not asked about the recommended dose. In that recommended dose, what is the maximum limit? That is what is asked in the question. So for that reason, what does our answer turn out to be? It becomes just 0.2 mg. 0.1 to 0.2 mg, it is the range. But the question asks for the maximum limit. So for that reason, the answer is 0.2. Now you understand? Like these are some of the traps that I would say, rather I would like to call it as traps, that the examiners set, or the people who set the question paper put into the add-on to the question paper, just to see how careful your reading is. Now if it was just dosage, of course you can write 0.1 to 0.2 mg, but here since they have included the word maximum dose, the answer should only be, or the answer can only be 0.2 mg. And if the question was the minimum dosage, then it would be 0.1 mg. And if the question was what is the dosage or advised dosage, it will be 0.1 to 0.2 mg. Okay, I hope that is clear. Now we shall move on to another question. The question says, in a plaster back slab, there is a layer of dash closest to the skin. Now, in the process of applying plaster back slab, we have to identify the layer which is closest or nearest to the skin. Now, this is how the text looks like. So, mostly what students do is they might look for this keyword skin, then closest. Now, if you just pause the video and go through these steps, the technique that the text says technique for plaster back slab, and different steps, 8 different steps are listed here. So like you would be running your eyes through these 8 points to identify this keyword skin or closest. But if you pause the video and if you go through these points, you will understand that you will not be able to identify such a keyword as such, skin or closest. Now this is about a total understanding of the technique and getting the right answer. Now if you're not able to identify this in the first go, don't waste your time. Don't spend too much time on such questions. You should be moving on. You should move ahead. And after completing the rest of the questions, if you have time, you should be coming back to this question. Now I'll tell you what the right answer for this question is. But I guess some of you would have already identified the right answer. If you go through the different steps, you can understand that they have explained the technique for applying backslab, how layer by layer different layers are added on. Now the first layer what they mention is measure a length of non-compression cotton stockinette from halfway up the middle finger to just below the elbow. So the first layer that is applied during plaster backslab is cotton stockinette. This is the first thing. Then what is done? Wrap cotton padding over top for the full length of the stockinette. Then on top of the stockinette, cotton padding is added. So this is the second layer. Then what? Measure a length of plaster of Paris 1 centimeter shorter than the padding or stockinette, which means that the third layer is plaster of Paris. Then fourth layer talks about immersing that layered plaster in a bowl. Then the fifth point says about like jewelry should be removed, all those. Then sixth point says that lightly mold the slab to the contours, some instruction is given. Then another general instruction, do not apply pressure over bony prominence is given. And then finally, wrap crepe bandage firmly around the plaster backslab, which means that this crepe bandage is the fourth layer. So in total, you can find 4 different layers in this plaster backslab. And the question is, in a plaster backslab, which is the layer which is closest to the skin? So you have to just think about it. Which will be the layer closest to the skin? The innermost layer. And what is the innermost layer? The first layer. This innermost layer. This innermost layer. This is the first layer, and that will be the one which is closest to the skin. So for that reason, the answer is cotton. Either you can say non-compression cotton stockinette or cotton stockinette, or simply you can say stockinette. So this is the answer. Non-compression cotton stockinette, or you can say stockinette. Okay, I hope you understood how we came at the right answer. Now, if you're not able to, as I mentioned earlier, if you're not able to identify such answers in the first go, move on and then later on come back to this question. Because there would be some instances where you cannot go for a word-to-word match between the question and the text. Okay? And even a synonym cannot be found. Here you're not able to find the synonym also. What is happening here actually, you have to understand the meaning of the entire text and then come to then derive at the right answer. Now we shall move on to the next question. The question says, staff should check whether a resident need to use dash or adapted drinking vessels. So staff should be checking about the requirement of the residents. Okay, now this is how the text appears. In hydration assessment, so check definitely means assessment. What are the things that the staff should check? Here it is given, conduct an assessment including. So these are the things that the staff should assess for. Medical history should be assessed, current medications, cognitive status, continence status. Then the residents, something should be the residents' usual hydration habits and current fluid intake patterns. That should be checked or assessed. Now here it says staff should check whether a resident needs to use. So they are focusing on some kind of requirement of the resident. Here you can see functional ability and requirements for aids. So requirement is nothing but needs. Okay, so it has been paraphrased. So what are the things that they have to check whether the resident needs or not for aid? Such as straws or special cups. So the staff should check whether the resident need to use. That is, the resident requires straws or special cups. So that is the answer. Now you know that you have 15 minutes for part A and you have 20 questions, so you'll be in a rush. So immediately as you are able to, identify the connection between the question and the text and you understand, this is the answer. So immediately the students write straws or special cups. I have seen a lot of students write the answer in this way. Now what is the problem with this answer? Writing in excess or writing which is already there in the question prompt will actually lead to wrong answer. Now here you see, is there a need for including special cups? You might feel that the special cups, I cannot find it in the question, but if you read it carefully, what is given here? Or adapted drinking vessel. This adapted drinking vessel is nothing but a paraphrased form of this special cup. Okay, so you have to read carefully. Already a paraphrased version of special cups is there in the question booklet in the form of adapted drinking vessel, which means that the right answer is just straws. Okay, now if you write straws or special cups, your answer goes wrong. Okay, now we shall move on to the next question. An increase in dash is a possible sign of overhydration. I'll show you the text. The text says like this: when symptoms are relieved, monitor the resident for the symptoms of overhydration. So here, instead of sign in the question booklet, it's given as sign, and here it is given it as symptom. Here sign of overhydration, here symptoms of overhydration. So all these are symptoms of overhydration. Now the question says an increase in something is a possible sign of overhydration. So here the points given are unexplained weight gain, peripheral edema, distension of neck veins, shortness of breath. An increase in something. So you understand that it is weight gain. It will not be an increase in peripheral edema, that's not logical. An increase in distension of neck veins, no. An increase in shortness, no. Of course they are talking about the weight gain. You understand that because it is weight gain. Here also students tend to make this mistake, that is an increase in, they very quickly write increase in weight gain. Now is that grammatically right? An increase in weight gain is a possible sign of overhydration. No. Is this gain necessary? Instead of gain, increase has already been placed in the question, which means that you just need to write an increase in weight is a possible sign of overhydration, because you know that you just need to copy and paste when it comes to reading part A. So while copying and pasting, you have to look around the words that are already there in the question. It should not be a repetition, and the answer you put into that blank should grammatically fit in well into that blank. So here increase is already there, and increase and gain, it's just one and the same. So if you write gain again there, your answer goes wrong, and the right answer here is just weight. I hope that's clear. Now we shall move on to the next question. Choosing an insertion point above the dash during thoracentesis reduces the chance of injury to the abdomen. It's talking about this thoracentesis procedure, and they're talking about an insertion point, choosing an insertion point above something. Choosing an insertion point above the something during this procedure reduces the chance of abdominal injury or injury to the abdomen. That is the question. So we have to choose above what point, above what the insertion point should be chosen so as to reduce abdominal injury. Let's look through the text. Now text thoracentesis procedure is given here. Now our keyword is insertion point, then abdominal injury to the abdomen. With that, I think we can come to this third option. Insertion point is here, then you can see abdominal injury here. So it is the third point that they are talking about. Now what is the confusion? Like sometimes some students say that, like, how is that justifiable, the answer? Because here the answer, let me tell the answer first. The answer here is 9th rib. The answer here is, this is the answer. Now sometimes students say that, like, no, in the text it says that insertion should be below the 9th rib and the question says that above. So how is it justifiable? But you have to understand the total meaning of the question. Don't just focus on a few words. Here what is said in the question, choosing an insertion point, which means that we have to select an insertion point above the 9th rib. And what does the text say? Insertion below the ninth rib should be avoided. So they are just contrast words. Same way how you think like above and below are contrasting, some words around that or surrounding that are also contrasting. So that will be the right answer. Here in the text it says that insertion below the ninth rib should be avoided. And here they say that insertion above something should be chosen, which means that the answer again here would be ninth rib. Isn't that quite tricky? So this is how you have to analyze. Don't just focus on words. Here insertion point you have matched and you think that I have to look for something above. But you see here something very exactly contradicting below. So you never come to that thought that okay, it will be the ninth rib. But no, when you read the sentence as a whole, here they are talking about something that should be avoided and here they are talking about something that should be chosen. For that reason, ninth rib here and ninth rib here goes in well. Now let's move on to the next question. The tissue surrounding the wound can become macerated if dash is not controlled by the dressing. This is another question which sometimes confuses the students. I'll show you the text. The tissue surrounding the wound can become macerated. So macerated is the keyword if dash is not controlled by the dressing. Now you go through the text and you identify this macerate here. What is given here? Excessive exudate can macerate peri-ulcer skin and should therefore be absorbed away from the ulcer bed. So here the question says the tissue surrounding the wound can become macerated if dash is not controlled. And here it is very clearly given excessive exudate can macerate. So what will be the answer here? The tissue surrounding the wound can become macerated if excessive exudate is not controlled by the dressing. This is one answer that majority of the students write. Now the problem with this answer is, here is there a necessity to include the word excessive? No. Excessive is the effect of something. That is, if you do not control this exudate with the dressing, then it turns out to be, it results in excessive exudate. So what you need to control is just the exudate. I hope that is clear. Now here it is given excessive exudate can macerate the skin. Of course that is true. But what you need to control, you have to control the exudate so that it does not turn out to be excessive. So it's not the excessive exudate that you have to control. Excessive exudate is the result of what? Not controlling the exudate. So what you need to control or restrict is just exudate. If it is not controlled, it will result in excessive exudation and that excessive exudation will macerate the skin. So what has to be controlled with the dressing is just exudate and not excessive exudate. So these are certain areas where you will have to apply a bit of your extra thinking. Now we shall move on to the next question. How much resuscitation fluid should a child receive per kilo over 20 kg? This is another interesting question. I'll show you the text. Here it's given about the resuscitation fluid, the measurements that should be given to children. So if you read through it, like here they have given how it should be, the measurement or how the quantity should be increased based on the weight. The question says how much resuscitation fluid should a child receive per kilo over 20 kg. So we have to identify the resuscitation fluid that can be given to a child who is over 20 kg. Now here it is given, give 100 ml per kg for the first 10 kg body weight. So if the body weight falls under 10 kg, up to 10 kg, for each 1 kg you have to give 100 ml per kg. Okay, that is up to 10 kg. That is for 1 kg child, you have to give 100 ml. If it is 2 kg, 100 plus 100, 200 ml and so on. Up to 10 kg, for every kg, you have to increase 100 ml. Then what is said? Plus 50 ml per kg for the next 10 kg. That is, first they have talked about 10 kg. Then for the next 10 kg means for up to 20 kg. For the next means up to 20 kg what should be done? From 10 kg to 20 kg, for every 1 kg 50 ml should be added on to the dosage. Then, but the question is not about 20 kg, it is over 20 kg. How much should be given if it is more than 20 kg? So what is given here? Plus 20 ml per kg for each extra kg. After 20 kg, what they have said, for every single kilogram, 20 ml should be added on. Now here, what students mostly do is that they add up all these values and they give some answer as 150 or 1050, like they multiply every single kg into 10 and then they add on all these 10 plus 20 and they end up giving some new answers which involves a lot of mathematical calculations. But see, what you need to understand is that this is basically a reading test. Your mathematical skills are not assessed here. The answer which you put into the blank should be specifically, explicitly given in the text. Only then it will contribute as an answer. So here the question is, for every extra kg, for every 1 kilo over 20 kg, how much ml of resuscitation fluid should be given? So it is just 20 ml. It is given here 20 ml per kg for each extra kg. So that is the answer. They have not asked you to find the total amount of resuscitation fluid that can be given to somebody about 20 kg. No. How much ml per extra kilo would be given after 20 kg? That is the question. So the answer is 20 ml. The answer is just 20 ml. 20 ml per kilogram. That is the answer. Okay, I hope that is clear. Now let's look at one more question. Actually, based on these, the traps and tricks that they add into the question. Like there's one question which is similar to that, wherein you have to think a bit to understand how the paraphrasing has been done. So I'm not going to analyze this. I want you all to do it on your own and post the answers in the comment section. So pause the video, go through the text, understand the question, keep in mind the traps that they set in the question, and then identify the answer and post the answers on the comment section. Okay, so with that, we come to the end of this video. Hope you found it helpful. Keep in mind that reading test is just about analyzing how well, when it comes to part A, how well or how quickly you can identify the right answer. You'll not have to do too much of thinking because it's just identifying or locating where the right answer is, copying it and pasting it. Never you'll have to introduce a new word. So it is about just understanding the meaning of the question and matching it up with the text. So we'll be back with more such videos. Until then, stay tuned.
Medcity International Academy. Trusted hands forever.